officially declaring a national emergency.
Now, join host Tim Seaman and 3 area medical experts in a live discussion with the latest information on the coronavirus and its impact on Siouxland. Coronavirus, facts and fiction.
And good evening, and thanks for joining us this evening here on KCAU-9, our Town Hall Coronavirus Fact and Fiction. I'm Tim Seaman, and from closing businesses to self-quarantine, the COVID-19 outbreak is overwhelming many people. That's why tonight we'll be joined by 3 medical and health experts to sort through the facts and the fiction. But first, let's take a look at the recent numbers concerning coronavirus throughout the United States and the tri-state area. Here in the U.S., more than 7,000 cases have been reported, with more than 100 deaths so far. The state of Iowa now reporting 9 new cases, bringing the state total to 38. Nebraska has confirmed 24 cases, and South Dakota officials now report that they have 11 cases at this time. Here in Woodbury County, there are no positive COVID-19 cases, and that is indeed good news. Joining me this evening to break down COVID-19 and the fact and the fiction are 3 local experts. Tyler Brock is nearest to me, the Deputy Director with the Laboratory Services Division of Siouxland District Health. Dr. Larry Voles from Mercy One Siouxland, the Chief Medical Officer there, joins us in the middle. And Medical Director at Unity Point Health St. Luke's, Dr. Mike Kapka, also joins us here this evening. And first, I want to just turn to you and say thanks. Your days are as busy as anyone in our community right now, so thanks for taking time. We're trying to show our own social distancing here, but yet provide some good information that folks at home can take a look at and have a better understanding of. And I want to start with the broad picture here. There are no positive test results, as I just said, here in Siouxland and Woodbury County. But Tyler, I guess I'd ask you first, where are we today compared to 2 weeks ago or 18 days ago, whatever that number might be?
A long ways. It's a lot different. Obviously, a couple of weeks ago, most of us probably had ball games that we were planning on going to, and you know, social calendars and that kind of thing. And now those are all cleared out because we've had just a rapid jump in cases here in the United States, both again across the country and even in our region. Maybe not right directly here at home, but certainly in our region, had lots of cases become increased. And obviously with just some of the new recommendations, the new proclamations from our governor and federal partners as well, we're seeing a huge change to people's lives, frankly, with the actions that are trying to be taken to keep us apart a little bit, to spread us out a little bit, to keep the spread of this virus down. And so, yeah, it's not an understatement to say that there's been a drastic change, both in just what's happening with the disease and what's happening in our lives.
And in that note, we've taken time in recent days to ask several questions of our viewers. And one of those, right off the top, are you worried about contracting COVID-19? Here's what our viewers told us. Am I worried? 41% said yes, I'm not worried. 59%. I turn to the doctors here. Do those numbers bother you at all, or is that what you might expect?
It's probably about what I would expect at this point, but it is concerning that people aren't worried about it. I think the concern that people need to be worried about, I think the majority or a lot of our population that gets sick will not get overwhelmingly ill from that. And so I think from that standpoint, people aren't. The concern is that there is a large percentage of our population that when they contract that, they will get very sick from this. And that's part of the concern, that people aren't worried about it. They don't feel like, well, it's not going to be a problem for me because I'm not going to get over sick and I'm not going to die from this. But what you do by contracting it is you put the rest of the population that is at risk for having a bad outcome related to COVID.
Dr. Kapka, give us an idea of the symptoms. We've got a graphic here, I think, that will lay those out. But we've talked about these for several days. The symptoms are fairly simple for what is obviously a very bad virus.
It typically starts out like a cold. One of the things that starts to develop usually is a fever, usually over 100.4 is what we're looking for to decide it's a significant fever. And then following that, it's respiratory symptoms. May have a runny nose, but it's development of a dry cough, and then eventually shortness of breath and difficulty breathing. as the infection extends from the upper airway down into the lungs.
Is there anything that totally separates differences from the common cold? I've been asked, well, how do I know the difference if I've just got a cough and a sneeze, or if it's this bad virus? Is there any one thing that would, if I see that, then I know?
Probably fever would be the thing.
Okay.
You know, usually with most colds, I don't think people get too terribly feverish. But it's a dry cough, and like I say, eventually shortness of breath that ends up tipping you off that there's something more significant going on.
I want to ask another question along those lines, and this is one that we've received from several people as well, and that is, if I'm experiencing these symptoms and if COVID-19 comes into my life, how long should I expect to need to stay at home? Is there a definitive answer for that?
Well, this has kind of been an ongoing development as well. But I think generally what we're talking about now is if you are someone who has it or you're someone who's suspected of having it, really what they're looking for now is that you can go back to normal routines 72 hours after your fever is gone. And that's 72 hours. That's 3 full days in the absence of any pain relievers or Tylenol or ibuprofen. And when your symptoms have gotten better, so your cough and your shortness of breath, those have gotten better. And when you have had at least 7 days since the symptoms began. So these are actually fairly recent criteria that have come out in the last few days, and that's kind of what the guideline is for going back into regular life.
Dr. Voles, we know we've talked a lot about if I feel ill, don't go to the urgent care, don't go to the ER, don't even go to my doctor, but rather call my care provider. How long do I wait until I do that? How bad do I have to feel before I call and I'm not just a burden of, no, it's not, thanks for calling?
Sure, I think when you're having those symptoms, when you suspect and you're having a fever and you're having the cough, the question is and the most important part of that is once you've had those symptoms, and the fever I think is really the key part of that. I think that's one of the key factors that's differentiating the cold and COVID is also muscle aches. You feel really, the flu is harder to differentiate between COVID than a cold is. So I think once you're having the fever and you suspect you have the flu, I would call your primary care doctor at that point. And then they can direct you where to go to get tested. But the thing we don't want you to do is just to walk into the emergency room, just to walk into your primary care's office. We really need you to stay at home because the vast majority of these, really 80% even plus of that, are going to not require any treatment, not going to require being in the hospital. And most of those people, and even some of the young people, may not really have even known that they had real symptoms. They were carrying the virus, they were shedding the virus, but didn't really have strong symptoms to really need any treatment. So most people aren't going to have to come to the hospital and should just stay at home to really prevent you from transmitting that virus.
Which, Dr. Kafta, to some people is the confusing part. If 80% aren't going to get seriously ill, it seems like it's not that big a deal, but it's who you could give it to that becomes the problem, correct?
Exactly, and that's what's sort of unique about this particular coronavirus that's circulating. It seems to be easily transmitted. It seems to be both through respiratory coughing and droplets that as people sneeze and cough that can be picked up by a person and get enough inoculum to get sick. It also seems to survive on surfaces, things that people touch, handle, for not just hours but potentially days. We're talking maybe 2 to 3 days at least, and in some studies in the past they've shown that this can hang around for 7 to 10 days. So paying attention to cleaning in your environment and good hygiene and good hand hygiene and good cough etiquette is really critical in both cases.
And just to add a little bit to that, the other thing that kind of makes this serious is that all these people getting infected, and even if a small percentage get fairly sick, that puts a pretty heavy burden on the medical community and the medical resources that we have, and that's another concern that's out there as well.
I wanted to bring up testing. Dr. Voles mentioned testing. Where are we at locally? I know today Governor Noem, South Dakota, announced that they were halting testing because they no longer had the supplies. They were waiting for their next shipment. Where are we at with testing? And Tyler, maybe you're as good as anyone on this here in our community. And will we see drive-up testing?
It's a possibility. That's something that's being considered. Testing is available. There's testing through the state laboratory, which is primarily intended for our most sick individuals, our most at-risk individuals. So that is available. There's also a lot of private laboratories and reference laboratories that almost every medical office and hospital has access to. So there are access to tests, but it's not unlimited access to tests. And I think that's the key. I mean, again, we talked earlier today about literally everybody in the world wanting a particular service, and so we need to be able to conserve those resources, save those for the people that are the sickest, that are the most vulnerable. There is plenty of testing available for those folks, but occasionally we'll get some people that are maybe less symptomatic and that kind of thing. The majority of those people probably do not need to be tested, and in a lot of cases won't be.
We've got another question from one of our viewers we'll get to in just a second, but while we're on the subject of care to the doctors here, where are we at this point as far as procedures at our local hospitals? I know in Des Moines and in Iowa City there's been talk about limiting those elective surgeries and trying to save not only rooms but the supplies and whatnot. Where are we at in Sioux City tonight?
So you're correct. So the American College of Surgeons and the Surgeon General have both suggested that we should consider stopping elective procedures. So we've been taking a day-to-day approach to that, trying to make sure, realizing that elective procedures still need to be done. And when we talk about elective procedures, ultimately, if those were to be rationed, that does not include certain procedures. Patients that are extremely symptomatic, cancer operations we would still be proceeding with. So I think when we talk about, stopping elective operations, it doesn't mean that we're just going to be taking care of gunshot wounds and
Sure.
severe emergencies. But right now, Mercy One is on a day-to-day making that decision. We want to make sure that we are, being prudent. We're being very careful about making sure that our PPE is being utilized, trying not to disrupt services, and really letting that decision be made at this point between the surgeons and the patients to be able to make that decision about whether that needs to be done. A lot of patients are sort of self-selecting and saying, I don't want to have surgery right now at this risk. I want to try and avoid the hospital if I can. And so that process is progressing. But at this point, we're still doing that. But it's as soon as this situation is so dynamic,
it is.
That as this changes daily, that could be a decision that we make in 2 days from now that we're stopping.
Dr. Kafka up at Unity Point Health St. Luke's.
Same thing at Unity Point, and we are working daily with folks over at Mercy One, coordinating what we're doing in terms of visitors and whatnot. And like I say, we're asking our folks to look at schedule elective cases currently and deciding whether those could be potentially postponed, and if possible, talk to their patients and see if they'd be willing to delay 30 days. We're kind of looking about 30 days out. But it's on a kind of a day-by-day basis, trying to decide what really is appropriate and trying to avoid unnecessary surgery that can be delayed.
Communities coming together, there's no doubt about that on all facets. I mentioned that question from one of our viewers here. Let's get to that right now. I've heard very little about how pregnant women are being affected. Are there special precautions they should be taking? Are they considered high risk? Doctors, I don't know.
Up to this point, the experience, I know in China, they didn't think that the coronavirus is as big a challenge as maybe influenza is for pregnant women. So they have not been, they're unique, of course, in terms of, what condition they're in, and when it comes time for delivery, and if somebody comes in and they're suspected of potentially have been exposed, or if they're actually a COVID patient, there's special precautions and stuff that will need to be followed. But in general, I think the feeling is that there's nothing unique or specifically that makes pregnant women more susceptible or having more difficulty than would be normally expected. So.
Did you have something?
Yeah, I would concur with that. I think most of the normal precautions we're asking for from everybody else would apply in this situation as well.
And again, as we mentioned at the start, if you're just joining us, our panel tonight, closest to me is Tyler Brock, the Assistant Director at Siouxland District Health. In the middle is Dr. Larry Voles from from Mercy One Siouxland, and Dr. Kafka from Unity Point Health St. Luke's, all answering your questions here tonight. We took polls, as I said, in recent days. We want to share another one of those with you. Has COVID-19 affected your day-to-day life? This seems like a pretty good no-brainer, I guess. 62% saying yes, but yet 38% of the people are saying no. You look across the community in the last 3 days as bars and the restaurants closed in mass groups. The streets are empty a lot of the time, other than the heart of the day. Do you get a sense, I know this was a discussion this morning, Tyler, especially with young people, that are folks participating in that community separation? And I know you're especially concerned about young people that still have that vulnerability in their heads.
Yeah, I think overall it's being taken seriously, and I think the majority of folks are adhering to some of these social distancing. But yeah, it's a challenge. You've got these kids that should be in school and they're not. You know, so what do? Well, you know, if it's nice out, a lot of times we're going to the playgrounds. We're, you know, playing basketball on the courts that are outside, or we're going and socializing in other areas. And as tempting as that is, we're really trying to encourage that distancing, trying to avoid those large gatherings and those groups that are so, you know, that the kids are going to be drawn to, of course, and we're just really trying to limit that kind of things, as tempting as it might be.
I want to bring up a graphic, if we can, that shows that curve and that peak, something that's been talked about from Washington to right here in Sioux City by health professionals as we try to flatten the curve. Just briefly, anyone can jump in and just update people how important this is.
Well, I know in China, when the virus first emerged, it occurred in a very large Wuhan, which is about 11 million population. There, for each case of the person became infected, they ultimately infected 2 more people. So it was an exponential kind of explosion. One person gave it to 2, you then with 4, 8, and then you have the cases that have already been infected, plus you're adding multiples on a daily basis, and which causes the sudden rise, as you see on that curve. We're hoping that by the isolation, the social distancing, we can slow down that 2-for-1 sort of effect on how rapidly the disease is going to emerge, and therefore to be a flatter curve and something we can hopefully manage through the health system without having major exceeding the capacities of our emergency rooms and hospitals.
And that's something that we do hear about on a daily basis on a national scene, is some hospitals not having enough beds or not having enough supplies. Locally here in Siouxland, how would you address that situation? At this point, we don't have positive cases, so it's lucky, but it's also, I think, safe to assume there will be at some point. So.
Yeah, I think we fully expect that we will be having cases here, but each day that we go without a case, we're eternally grateful for that. I think, but we both systems are working together on a daily basis to make sure that we're able to be prepared for that surge capacity if we get that. And the concern with COVID over the flu is that the flu mortality rate, or rate of people dying from the flu, is really about 0.1%. COVID can really be up to 2.5%, which that's a dramatic difference between that. And that number is entailed assuming that we can manage those patients. That's just patients that are getting adequate care. The concern that we have is really twofold. If we didn't implement these social distancing, limitations in these rules, is that there's 2 concerns. One is that as soon as we overcome our ability, and now we have more patients than we have ventilators, if patients that have severe lung disease and they can't breathe on their own and they need this machine, we don't have that. The mortality rate really goes up. And that's based on also on our current staffing models too. We also have to realize that all our healthcare professionals are really are at high risk because we're going to be around those patients. And as soon as our healthcare professionals or our nurses and our respiratory therapists and the entire care team start getting sick, now we really hinder our ability to take care of those patients. Even if we have the ventilators, there's a chance that we may not have enough people to take care of them if we start having to send our healthcare workers home. So it's really important to make sure that we keep that rate low so that we're not overwhelming that, because that's when the mortality rate goes really high.
As folks think about going out and joining with a group somewhere, keep that in your mind. I guess that's what it's all about.
Another thing to point out, Tim, is that we are now dealing with people that are persons under investigation, those that are sick enough with these possible viral pneumonias, but not necessarily due to the coronavirus. When they come into the hospital, until we have their test results back, they're put in isolation as though they actually have the coronavirus or COVID-19. So there is some extra consumption of personal protective equipment and things like that, just handling those folks until we know that they're not infected and that they're free, that can be brought out of their isolation precautions. So.
Folks in the healthcare industry, much like the media, face the question every day as you're overselling the story. It's really not that bad. This was another of the poll questions we asked our viewers was, do you feel the media is currently fueling the panic associated with COVID-19? And the statistics tell the story right there, I guess. But it is something that you can't oversell at this point.
Yeah, I mean, I would agree with that. I mean, we want to continue to get the word out. We want to continue to kind of make people understand the seriousness of this. But of course, it's, you know, whenever you're thinking about something all the time, you know, it does tend to make us a little bit more nervous and make us a little bit uneasy. It's impossible to get away from this topic right now because it's in really every facet of our lives, but it's necessary. It really is.
What myths are out there that you hear on a daily basis that need to be dispelled the most, I guess, at this point? And I'd throw that out to all of you, because there are many of them.
I would say one of the things we're hearing the most about is that there is no testing being done. That's probably one of the things that we've tried to address these last couple of days, that there isn't testing being done. There's been a lot of frustrations with people trying to get testing that say that they're not able to. And again, every case is going to be unique, I'm sure, but I want to assure people that for folks that truly need to be tested, there is testing available. But yes, if you're one of the folks that has much less symptoms, that kind of thing, there's a chance that you won't get tested. But there is testing being done, and there is testing being available.
I think the myth that I think is most people feel like this is just the flu. And why are we making such a big deal about it? But I think the fact that this is far more contagious and it's far more deadly than the flu is, and that there's no immunity to this. Typically, a bad flu season can be fairly overwhelming, and that's even in the setting of being able to immunize a large number of people before that. So normally the healthcare workers would have received flu immunization. So this really isn't just the flu. This is a very different disease that's much more contagious and much more dangerous.
That's one question that I know I've been asked is, well, I got my flu shot. Will that help squelch the effects of COVID? Dr. Kafka?
Unfortunately, no. Yeah, there isn't any crossover, as far as anyone knows, in terms of the immunity effect of the vaccine and having to do anything with coronavirus. It'll be great when we do get a vaccine, but that's the other concern, is that could take 12 to 18 months to actually come up with an effective vaccine. So we have to rely on the social distancing and just the good hand hygiene and all the other measures that are just being done for the public to really try to sustain and control this infection.
Is it fact or fiction that we should be wearing masks on a daily basis here in Sioux City?
It's fiction. The general public does not need to wear masks, okay? The masks are going to be primarily for our medical folks that are dealing with suspected cases, that are dealing with people that, you know, most likely have it. Now, there might be some call for masks if a person actually does have it, or if a person is quarantined, but for some reason they need to go out in public, they can't avoid that for some reason. There might be some small uses for general public to have masks, but for the most part, that's not recommended for most of us.
Another one that I've seen pop up on social media regularly is about the virus itself, and that it escaped from China. Talk just a little bit about that, if you would.
Well, the virus, it seemed to develop and came out of a fresh market, seafood fresh market, an animal market in Wuhan. The Chinese, for all their experience with SARS, which was another similar coronavirus that occurred about 2002, 2003, they have very aggressive monitoring systems, and so they picked up on the infection that did emerge from there very quickly. It only took them about 30 days to actually identify it with the few cases that they had come up with. So, yeah, it's unusual, but like I said, we've developed a great deal of information about it, and
it's traveled across the globe at this point from that start. How about I need to shave my beard or mustache? I've heard that could help contain the virus. Any truth to that? Fact, fiction there?
I'll let Tyler answer that because I have a beard. So.
No, it's not. I think, you know, sometimes there can be issues with some people with larger beards and things like that, getting masks to fit good and things like that. But that's just not a factor for.
And some of these sound silly, but yet there are questions, there are thoughts that people have. Another one: can COVID impact my pets? And we may not know the answers to all of these. I understand that.
What they're talking about now is, you know, we are asking people when they're isolating themselves to also, you know, in addition to isolating family members, that you also isolate from your pets as well. There really isn't a lot of documentation that says that pets are going to get this, or that pets are going to be a common way to spread this, but it's mostly just out of the abundance of caution.
If I receive the virus and I don't know it, we talk about people that are carrying it today and don't know it because the symptoms are so minor. Is there a standard window of growth for the virus before I finally feel, I think I do have something going on here? Or is that something we're still learning?
Studies so far show that it takes about 5 days on average for folks that have, once they've been exposed, to actually develop the symptoms. It can range anywhere from like 2 to 7 days as a range. The problem is during that 5-day period until they're actually ill, they can be shedding the virus and be exposing other folks. So that's where the social distancing and good hygiene and all that stuff that comes into play. But some people can go for a long period of time. That fever is not an immediate thing. In China, when they admitted patients to the hospital for investigation, only about 40% of them had fever at that point. They had respiratory problems. But ultimately, 80–85% of those did develop the fever. So fever is one key thing, but just respiratory symptoms that are out of proportion to what you'd expect for a common cold or the flu is kind of a tip-off that there's something else going on.
Tyler Brock, I wanted to ask you again, we talked about testing, it just came to me. Are folks having to pay for that test at this point? There's been discussion today from the White House that the tests will come at no cost. Are we at that point now or not?
In most cases, if you are tested using the state laboratory, which there's criteria, and it's relatively strict criteria on who can be tested through that mechanism, there won't be a charge for those. It is a possibility that insurance would have to cover a test done at a private laboratory or a reference laboratory. So there is possibility of charges in that respect. But yeah, I know they're talking about a lot of things at the federal level as far as kind of helping folks through those.
Just lastly, before we wrap up, I want to give each of you just a couple of seconds to make a closing comment, if you would. Dr. Kafka, we'll start with you. As we know, this is days and weeks possibly from being past us.
Yeah, this is kind of a new normal. People just need to adopt the new guidelines in terms of avoiding interacting in large groups, social distancing, all the good hand hygiene. That's really what's going to make a difference to slow us down.
Dr. Bowles?
Yeah, I think I want the community to really understand that this is the entire team of healthcare providers in the region are working together. This is really a community-driven effort to get this done. Between, Unity Point and Mercy One, we have daily calls with the entire senior leadership team walking through what we're doing, preparing, supporting each other in those transitions, figuring out what we're doing with patients and what you could take that I can't take. Working with Community Health Center every day to be able to work through Siouxland Public Health.
And Tyler, I don't have time for you to give us a comment because we're out of time now, but I do appreciate you being here, all three of you being with us tonight. And we hope you'll join us again next week. We'll be back next Tuesday with another town hall, this one featuring city, county, and emergency personnel, our day-to-day life here in our community. Again, that's next Tuesday. We'll hope you'll join us then. Good night.
KCAU 9, Siouxland Proud.